Hey everyone, Dr. Chris here, and today we're going to talk about things your surgeon wants you to know. Patient tips for improved surgical care.
And I need all of you to stop what you're doing and listen.
Hopefully, in shedding light on some of these topics, I can make people's visits to me, or perhaps other surgeons, go just a little bit more smoothly. One of the first things that I need you to know is that I'm busy. Like, really busy. I can see anywhere from 70 to 100 patients in a clinic per week, sometimes even more. I'm in a group of 4, so I'm on call at least 1 day per week and at least 1 weekend per month. A few days per week, I'm in the operating room, usually operating on at least 3 to 4 patients per day. I'd say on average, I work between 80 to 100 hours per week. So what's the takeaway? If things don't happen in the expeditious fashion that you anticipate, it may be for a number of reasons, many of which are outside of my control. Government funding, hospital cutbacks, staffing issues, etc. I can assure you, I am not trying to torture my patients with unnecessarily long wait times and unsatisfactory care. The typical OR wait time for me is about 5 to 6 months, and that's after consultation. So if you've been told to expect a call from my secretary to book an appointment, if she doesn't call you the next day or even the next week, it's because the appointment is not going to be immediate. She'll get to you. Also expect when you come to see me that you might be waiting for 15, 30, 45, 60 minutes or even longer. On occasion, I've had people wait for up to 3 hours. Yes, I did say 3 hours in the office to see me.
Oh, hell no!
Now I know what you're saying. You'd think it would be a relatively straightforward thing. Book a time to see the patient and see the patient at that time.
Tell me something I don't know.
However, it's more complicated than that. Sure, if I only booked 10 patients a day, I'd have plenty of time to talk to each patient. The thing is though, if I only booked 10 patients a day, you'd wait forever. And I do mean forever. At least several years, to get an appointment to see me. You either wait a really long time to see me, or you may have to wait a long time in the office on the date of your appointment. Plus, if you know to expect it, and I am telling you to expect it. I totally didn't expect that. I told you to expect that. I also want you to know you do need a referral to see me. I know this is a hassle, but because I'm a specialist, I'm trained to be really good at fixing certain problems. The more time that is spent seeing patients with ailments that don't pertain to this specialty, the more time that is wasted, and the longer it will take for patients I should be seeing to get an appointment. While it may be inconvenient for you to see your family physician first, it really benefits you and everyone else in the end. Your wait time would otherwise be longer than it is now. Sorry doc, I missed my appointment. I was sick, I had a family emergency, I blew a tire, my dog ate my homework. I know, I've heard it all. As soon as you know you can't come to an appointment, be sure to call us. We can make sure we can put somebody else in your spot. Another thing that's really important for you to know is that in order to assess you properly, I'll need updated images. And by that I mean radiographs, ultrasound images, or potentially MRI or CT scan. Surprising as it may sound, I'm not really a superhero, and I can't see inside your body with my X-ray vision.
That's nothing compared to my heat vision, which would really do some serious damage.
While I typically make a provisional diagnosis based on my history and my physical examination, I do use imaging to corroborate or solidify my suspicions. My secretary will need both the referral and updated imaging before she will book you an appointment. And unfortunately, last year's imaging simply won't do. Things change over time, and you really wouldn't want to come see me after months of waiting, only for me to tell you, can't help you yet because I don't have the appropriate imaging. I know most patients wouldn't appreciate that. But doctor, can't I just make the appointment with you? I'm planning to get my imaging done this week. It'll just make things go faster. Sorry, nope. Things come up, people get sick, and then whoops, no imaging when you come to see me. No good. Let me repeat, my secretary will book you an appointment after she has the imaging in hand. And a note to the GPs, it's your responsibility to order the imaging for your patients. If in doubt, X-ray it out. And another point, I practice stoicism for my own peace of mind. Some people say that all surgeons are heartless bastards.
Mr. and Mrs. Griffin, I'm afraid your coma's in a daughter. I mean, your daughter's in a coma. Brain freeze.
Keep in mind that we deal with suffering people all day, every day. sometimes even in life or death situations. Because of this, it may seem like we are insensitive or emotionless, but if we let our emotions take over whenever there was a sensitive issue or case, we would never be able to do our jobs. When shit hits the fan in the operating room, you need me to be able to function. And now is something that I think that is really important for you to hear. And that is, recovery is in large part your responsibility. And it's not going to be easy. In fact, it's going to be difficult. Quite difficult. It's important for you to take an active part in your physio. If instructed to do so, be sure to get moving as soon as possible. And where physiotherapy is concerned, you can go to anyone you want, but I feel that finding someone that encourages you to move and helps you to get moving on your own, even though it may hurt like heck, is the person that you want to see. Recovering from an injury or a surgery can be a very difficult and a painful process, and you may be tempted, you will be tempted, to just sit back and let someone else do all the work. Take my advice, don't. While passive modalities such as manual therapy, ultrasound, and TENS may have their place, the idea is for you to move the affected appendage through as large a range of motion as possible, as soon as is possible. But the bottom line is, you're gonna have to do work on your own, and you're gonna have to work through the pain. And another point, we encourage you to ask questions. Having surgery is a complicated thing and a difficult time for you and your family. Undoubtedly, you'll be given lots of information that is new to you, and you'll have lots of questions about it. As the questions come to you, it's a good idea to write them down. That way you'll have them ready when we come to talk to you. The more informed you are, the easier it is for you to make decisions and the better your outcomes will be. Also, second opinions are fine, but using Dr. Google is not the best idea. We know that the moment that we give you a diagnosis, especially if it's not something you are expecting to hear, you're going to be looking it up online.
Listen to me, like I do this all the time.
And while we want you to be informed about your condition and your upcoming treatment, the internet is not necessarily the best place to be looking for specific advice. Getting a second opinion from a board-certified surgeon who has trained in his or her field for several years is a much better idea. And another point, surgery starts even before going into the operating room. If you smoke, stop smoking as soon as possible. The longer you are smoke-free, the better. Even a few days or a few weeks is beneficial. If you're not eating healthy, that's something else you should do. Your overall health directly affects your recovery after surgery and the likelihood of you experiencing complications. And that leads me to another thing. Complications happen. Pneumonia, urinary tract infections, wound infections, unexpected bleeding. These are all types of complications that can occur under even the best circumstances. Other things happen sometimes because surgery is difficult. Remember also that surgeons are not robots. We are not perfect. If you're worried about complications, be proactive about it. Ask your doctor beforehand what could possibly happen and how those complications are treated. Better yet, ask what the best ways of preventing them are. It's also important to very carefully follow instructions post-operatively. So many people say, whoops, dog, I got my knee or ankle wet, but I had to shower. But I told you not to. And really, I don't say these things just to hear myself talk. Hey Chris, you shouldn't get your bandages wet. Yeah, I know. I'll try not to, Chris. I say them because I want you to heal properly. And if that means not taking a shower and washing the rest of your body with a washcloth, then so be it. Otherwise, you could end up with an infection. And now for a little bit about pain. Pain is inevitable. That is, you are going to have it. There is a big misconception that pain medication will erase it completely. In fact, it is almost impossible to take away all of your pain without some other, sometimes dangerous side effects.
We need justice!
The main objective of pain medication is to decrease your pain symptoms, not completely erase them, so that it is tolerable and so that you can walk around, function, and participate in therapy when it is required. So there you have it. Those are just a few of the things that your surgeon wants you to know. I hope that these tips that I've provided help you to be a better patient.
Because we don't like to talk with doctors.
And help you to have a better surgical experience. If you're new to the channel, be sure to subscribe and hit the notification bell. And if you like what we did, be sure to give us a big thumbs up. And as always, that's been a word from Dr. Chris, not your everyday ortho.